Welcome to the Spinal Chat Podcast, powered by the Pennsylvania Chiropractic Association, where science meets purpose. This is our deep dive series, where we go beneath the surface of chiropractic research to uncover the findings that matter most to you and your patients. Today, we're unpacking one of the most widely cited studies in our field, association of spinal manipulative therapy with clinical benefit and harm for acute low back pain, published in Journal of the American Medical Association. We're taking a close look at what the evidence actually shows, how the data was gathered across 26 randomized trials, and why this study continues to shape clinical conversations, payer decisions, and policy debates. If you've ever had to defend your outcomes or explain the value of what you do, this research gives you language, clarity, and confidence. Let's dive in.
All right, let's tackle a topic that, well, statistically, almost every one of you listening has probably dealt with or, might deal with someday. Acute low back pain.
So common.
Exactly. And it's not just annoying, it can completely throw your life off track. You end up just desperately looking for quick relief.
Absolutely. The pain can be overwhelming.
But what if that very first choice you make, the first person you see, doesn't just affect how quickly you feel better, but actually, changes the whole game? Maybe even whether you end up needing surgery.
That's a crucial point. The starting point matters immensely.
So our mission today is to really cut through all the noise and do a deep dive into two key pieces of research.
Right.
These sources look right at back pain and, importantly, the role chiropractic care plays. We want to give you a much clearer picture, not just of what might work, but why that initial decision, who you see first, might be way more predictive than you think.
And what's really fascinating here, maybe a bit daunting if you're in pain right now, is that even though acute low back pain is incredibly common, lifetime prevalence is over 50%.
Wow, over half.
Yeah.
Right.
There isn't just one single treatment that everyone agrees is definitively the best.
So lots of options, which can be confusing.
Exactly. It makes making an informed choice, especially right at the start, incredibly important. It's really a pivotal moment for your recovery.
Absolutely. And that brings us perfectly to our first source, this really striking study. It looked at workers in Washington state who had a new back injury claim.
A specific population there.
Yeah, and they tracked a decent number of people, 1,885 workers. And what they found about their treatment paths is, well, kind of startling.
Okay.
Within just 3 years of that initial injury, 9.2% of these workers had lumbar spine surgery.
Nearly 1 in 10. That's significant.
It is. But then the researchers dug into who these folks saw first for their back pain. And that's where things get really, really interesting.
The who you see first factor.
Precisely. It turns out the very first provider they consulted was a surprisingly powerful predictor of whether they ended up having surgery later on.
So that initial contact point really channels people down different paths, like a fork in the road almost.
Exactly like a fork in the road. And here's how dramatically those paths diverged. Get this. A staggering 42.7% of workers who first saw a surgeon for their back pain ended up having surgery within 3 years.
Wow. Over 40%. That's high.
It's incredibly high. Now, hold on to your hat for the contrast. Compare that 42.7% to just 1.5%. 1.5% of workers who first went to see a chiropractor.
1.5. The difference is enormous.
It's monumental. We're talking nearly 30 times lower odds of having surgery if your first stop was a chiropractor's office.
30 times. That's not a subtle finding.
Not at all. It just makes you wonder, doesn't it? About how the system is set up or how people usually seek help and what that might be leading them towards, maybe without even realizing it.
It really does. It's a huge potential red flag about the pathway itself. The authors of this study, they really hit it on the head, saying who you see is what you get.
Right.
And this wasn't just, a simple correlation they observed. They did the work. They adjusted for things like how severe the injury was initially, age, other health problems.
So it wasn't just that stiffer people went to surgeons.
Exactly. They accounted for that.
Yeah.
And even after all those adjustments, starting with a chiropractor was still linked to significantly lower odds of surgery consistently.
Do you remember the actual statistic on that?
Yeah, the adjusted odds ratio was 0.22.
Okay, so for people listening, what does 0.22 mean in plain terms?
It basically means that after accounting for those other factors, the workers who saw a chiropractor first were about 78% less likely to end up having surgery compared to those who started with a surgeon.
78% less likely. That's incredibly strong evidence.
It is. It's robust. It really reinforces that idea. Routing to surgeons often led to high surgery rates, while starting with chiropractic dramatically cut that risk. That first point of contact really seems to act like a gatekeeper.
A gatekeeper, directing you towards either conservative care or potentially much more invasive procedures.
Precisely. It's not just about the treatment received later, but that very first door you walk through seems to heavily influence the entire journey.
That's such a powerful insight, and it makes me ask, given these numbers are so stark, why isn't a chiropractic first approach talked about more? Or even, recommended more often, especially if it helps avoid major surgery?
Well, that's the million-dollar question, isn't it? This study provides really strong backing for exactly that. It suggests chiropractic isn't just, say, a safe, conservative first step.
Which is good in itself.
Absolutely, but it goes further. It can be a highly effective pathway to actually avoiding surgeries that might not even be necessary. And think about the downstream effects. Lower costs, obviously, for everyone involved, less time off work, less difficult recovery.
Better outcomes overall for the patient.
Exactly.
Yeah.
Better outcomes for you, the person dealing with the pain. It's compelling evidence for considering that chiropractic first idea, especially now when we're all looking for solid alternatives to opioids or jumping straight to invasive procedures.
It really reframes it, not just as a treatment option, but as a strategic initial choice.
Precisely. A choice that could significantly change your long-term health path for the better.
Okay, so that Washington state data makes a really powerful case for considering chiropractic first, particularly if avoiding surgery is a high priority for someone.
Definitely.
But that raises the next logical question. Okay, it might help avoid surgery, but what about the treatment itself? Spinal manipulative therapy, SMT, the core of what chiropractors often do. Does the science show it actually works for acute back pain? And, maybe just as vital, is it safe?
Right. Excellent follow-up. Because avoiding surgery is great, but you also want effective relief, safely. So for that, we look at our second major source, a really comprehensive systematic review and meta-analysis published in JAMA back in 2017.
JM, okay, so high-quality evidence.
Very much so. This review aimed to pull together all the good studies on SMT specifically for acute low back pain. That's pain lasting up to about 6 weeks.
Okay.
They meticulously looked at 26 randomized clinical trials, the gold standard in research involving hundreds and hundreds of patients, to get a really clear picture of both effectiveness and safety.
And what did they find on the effectiveness side? Did it actually help with the pain?
Yes, it did. Based on moderate quality evidence from 15 of those trials, covering almost 1,700 patients, they found that SMT was associated with statistically significant improvements in pain.
Okay, statistically significant, but what does that mean, like, practically?
Good question. On a standard 100 millimeter pain scale, the average improvement was about 10 millimeters. Now, researchers often describe this as a modest but meaningful benefit.
10 millimeters. Can you translate that into something someone feeling that acute pain might recognize? What difference would that make in their day?
Sure. Think about it this way. For someone really struggling with that sharp new back pain, a 10-point drop might mean they can actually bend over to put on their socks with noticeably less agony.
Okay.
Or maybe they can sit through a meal without constantly shifting or get a bit more comfortable to fall asleep. It's often enough of a change to let them start moving more normally again, which is huge for recovery.
And how does that compare to, say, taking medication?
That's another key point. The review noted this level of benefit is actually quite similar in size to what you typically get from common NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen for acute low back pain.
Interesting. So similar pain relief to NSAIDs.
But potentially without some of the common side effects of NSAIDs, like stomach issues, especially with longer use.
Okay, that's helpful context. What about function? Did it help people actually move better or do more?
Yes. That was the other part of the effectiveness finding. They also found moderate quality evidence, this time from 12 trials with over 1,300 patients, that SMT was linked to statistically significant improvements in function too.
So not just feeling better, but actually doing better.
Exactly. On a common 24-point disability scale, the improvement was between about 1 and 2.5 points. That might sound small, but it translates to being better able to do daily activities, lifting things, walking, just getting around with less limitation helps you get back to your life.
That makes sense. Pain and function improvements comparable to NSAIDs. Now, the big one, safety. People get nervous about spinal manipulation. What did this huge review find about risks?
Yeah, safety is always paramount, especially with hands-on therapies. And here, the news from the JMAO review was really, really good.
Yep.
Across all those randomized clinical trials they analyzed, 0. No serious adverse events reported from SMT.
None at all?
Unreported in the RCTs. That's a major finding. And the quality of evidence supporting this safety finding was rated as high.
Wow. Okay. That's very reassuring.
It is.
Mm-hmm.
Now, they did acknowledge that minor temporary side effects are relatively common. Things like feeling a bit more sore or stiff locally, maybe a temporary headache after treatment.
Right. I've heard people mention that sometimes.
Yeah, case series suggests this happens in maybe 50% to 67% of patients. But, and this is key, these effects were generally mild and went away on their own pretty quickly.
So temporary discomfort, but nothing serious or lasting.
Exactly. And interestingly, some studies found similar rates of these minor issues in people getting other types of manual therapy, or even in control groups who didn't receive SMT at all.
Huh. So maybe not even specific to the manipulation itself sometimes.
Could be. The main point is the risk of anything serious seems exceptionally low based on the best available evidence. So you're looking at modest but real benefits for pain and function with a very high safety profile.
That combination, meaningful help, low risk, really does make it seem like a strong contender, especially compared to drugs with side effects or the inherent risks of surgery.
Precisely. It reduces anxiety, helps you get back to normal faster, and generally offers a better overall experience for many patients dealing with acute pain. The review did mention some variability between studies, what they call heterogeneity,
Okay.
but the overall picture held firm. Modest benefit for pain and function, coupled with low risk of serious harm. It really solidifies SMT's place as a safe, effective option.
Okay, so let's bring this all together then. What's the big takeaway for you, the listener, maybe someone who's dealing with acute low back pain right now or knows someone who is?
Yeah, let's synthesize.
We've seen this really striking real-world data from Washington State. It shows that who you see first matters immensely. Going to a chiropractor first was linked to an almost 30 times lower chance of ending up with surgery.
A massive difference.
And then we've looked at the broader scientific picture from that big JMA review. It shows that spinal manipulative therapy, the main tool for chiropractors, provides modest but statistically significant improvements in both pain and your ability to function.
And crucial.
And critically, it does this with a remarkably high safety profile. Serious side effects are essentially non-existent in the trial data, though some temporary minor soreness is possible.
So putting those two pieces together, what really emerges is the powerful value of considering conservative care, like chiropractic, as a genuine first-line defense.
Yeah.
That chiropractic first idea isn't just about dodging surgery, although that's obviously a huge potential benefit.
Right.
It's also about potentially improving your overall recovery, cutting healthcare costs by avoiding more invasive and expensive routes, and really giving you options that fit with a less is more approach when possible.
It encourages you to think critically, doesn't it, about the standard pathways and maybe question the automatic assumptions about where to go first.
Absolutely. It empowers you, the patient, with solid evidence. It gives you the knowledge to have that conversation and make a truly informed choice, putting the decision-making power back in your hands.
So this deep dive, it really shows us quite unequivocally, I think, that for acute low back pain, that initial choice of provider can be a genuine fork in the road, a pivotal moment.
Mm-hmm.
The evidence points strongly towards chiropractic care as a powerful conservative option, one that can lead to better outcomes, dramatically slash the odds of needing surgery.
All while offering real, though modest, relief for pain and helping you function better.
And doing it safely, with minimal transient risks.
So empower yourself with this knowledge.
Yeah.
Use it. Talk about these evidence-based options with your doctors, with your providers.
Mm-hmm.
Advocate for the path that feels right for your long-term health.
And maybe this leaves us all with a final provocative thought to chew on. In our current healthcare system, which often seems structured to lean towards drugs or more invasive procedures first, what are the bigger implications of findings like these?
If we really took this evidence seriously, how could integrating conservative first contact care like chiropractic more broadly change how we approach not just back pain, but maybe other common conditions too? How could it reshape patient outcomes, public health, and even healthcare policy down the line?
That's the deep dive for today. A special thanks to the research team behind this JAMA systematic review for giving our profession something rare. High-quality evidence showing that spinal manipulation produces measurable improvements in pain and function for acute low back pain with only minor and transient side effects. You'll find the full study and supporting resources linked in the show notes. And if there's a piece of research you'd like us to break down in a future episode, we'd love to hear from you. To strengthen the voice of chiropractic in Pennsylvania, Connect with your legislators, support the PCA PAC, and, if you haven't yet, become a PCA member today. If you enjoyed this episode, share it, subscribe, and stay connected for more insights, stories, and science shaping our profession. Until next time, stay curious, stay engaged, and keep advancing chiropractic care in Pennsylvania.